Hello, my name is Oscar Ramos, and these are my ethical principles in nursing. When I think where my nursing ethical principles come from, I must go back where my servant leadership career all started. This occurred when, as a 12-year-old, I was introduced to the Boy Scouts world in my home country of Ecuador. At that early age, I was exposed to the idea of becoming a loyal servant to society. The tenets of the Scout Oath and Scout Law built within me the foundation that allowed me to become the type of registered nurse that I am today. The Scout Oath states, I promise on my honor that I will do my duty to God and to my country, that I will help my fellow man in any circumstance, and that I will comply faithfully to the Scout Law. The Scout Law states, the Scout measures his honor in being trustworthy, is loyal, is useful and helps others without thinking of compensation, is friend of all and brother of any Scout without distinction of belief, race, or social class, is polite and chivalrous, sees in nature's God's work, he protects animals and plants, obeys without talking back and doesn't do anything halfway, smiles and sings in his difficulties, is thrifty, hardworking, and careful of the property of others, is clean and healthy, pure in thought, words, and actions. I hope you can appreciate that by following this oath and law for most of my professional life, how easily it was for me to be the best possible servant of people. In my past careers as an EMT, paramedic, ER tech, 911 dispatcher, and now as a psychiatric RN. Embedded within that oath and law, you will see the birth of the professional values that I emphasize every day in my nursing practice as a servant of God. I value human dignity first and foremost. I always consider, respect, and honor the values, beliefs, and points of view of my patients and their families. I do not judge them. I actually learned this last core foundation from my grandmother, who pointed to me the wise words from Mother Teresa, who said, if you judge people, you have no time to love them. I feel love is respect. I pursue equality with my care, getting in the way or stopping people who attempt to discriminate my patients in any way. I have seen this extensively in emergency care, where the most affluent patients with health insurance were most of the time provided the best care, while the poor, uninsured patient was not. I have battled many doctors, nurses, and administrators on this subject to support this ethical value. I strive to do whatever is within my power to prevent or alleviate suffering of any kind, whether it's physical, psychiatric, or emotional, to my patients. I strive to assure they feel safe wherever they are. Oftentimes, I find the suffering in my field can be reduced just by being an honest listener, by making sure that my patient understands that I am here right now, devoted to listen to them to find a way to satisfy their needs. I empower my patients to display the highest level of autonomy with their care. I need them to know always the why we have to do something right now and provide options for their care. I am always transparent with information on hand with no surprises. Ultimately, it will be their choice, unless safety is an issue, of how we're going to proceed with their care. I want to give them back self control with what is next in their life. I make sure my patients can immediately develop a sense of trustworthiness with me regarding the options for their care. I do not lie to them. I don't circle around the bush, even if it's bad news. I also make sure I maintain appropriate boundaries, so I provide always a therapeutic relationship and not a dual one. I am there to serve my patients, not for them to serve me. I strive to make sure everyone learns, understands, and respects the rights of my patients, particularly their right of privacy and confidentiality. I go around locking up computer monitors left on a patient chart and putting other patient documents away after no one else is using them. I shut people down when I hear them talking about a patient and other people may hear them too. Yep, I am sort of annoying like that, but some people are just not aware how easily they can break these rights with their carelessness. As I have become involved with trauma-informed care, TIC, and collaborative problem solving, CPS, approaches in my hospital during the last 5 years, I also use many techniques from these two evidence-based practices to enhance the ethical care of my patients. When I'm faced with a patient struggling and I feel it is due to a traumatic nature, I no longer think of what is wrong with you. I now change my question and ask, what happened to you? You will be amazed how your point of view changes and what more you can discover when you simply change how you ask this very simple question. When I come across a patient who appears to be having difficulty coping with his or her environment and their peers, maybe having problems making decisions, or difficulty handling transitions or switching tasks, or simply problems handling directions, I see it as opportunities to use effective CPS skills. With CPS, I know people do well if they can with the skills that they have. If they lack a skill, I try to teach it to them. If they cannot learn right now, I strive to decrease the demand on their skills. It is amazing how CPS works. More people should try this. It's the right thing to do. All these values and skills, which are well embedded in me, make the foundation of my personal nursing philosophy and my ethical skills. Nursing is an art that requires never-ending learning and striving to confront more challenging situations. I learn every day how I can become a better nurse tomorrow.